to FIU. Today is a great day for FIU, but it's actually a greater day for the South Florida community. So thank you for coming. My name is Ruben Almaguer. I'm an Assistant Vice President here over Emergency Operations and Emergency Management. I also like to remind everybody today is probably the safest location you can be in South Florida. So we're blessed to have, and at this point, before I move forward, this couldn't have happened today, this event, without some key partners within the South Florida community that I'd like to personally recognize. First of all, the Bachelor's Foundation, Florida Blue, Nicholas Children's Hospital, Leon Medical Center, Baptist Health and West Baptist Hospital, Federal Express, Miami-Dade Fire Rescue Department, Forts USA Medical, and the Florida Department of Health. I'd also like to make special mention of Trustee Emeritus Al Dawson. Thank you, sir, for attending. There's other, obviously, individuals here that are not on my list, that this could not have been impossible, so I apologize if I've left your name off. The reality is that this event today, or more importantly, FIU-FAST, this new vision of the Dean of what can change the lives and reduce suffering, not just in our community, around the world, couldn't have been done with actually quite a few different people over the last 2 years. At this point, I'd like to introduce the founding Dean and Senior Vice President for Health Affairs at the Wertheim College of Medicine, Dr. John Rock.
Thank you. Well, this is a very special occasion. The launch of the FIU-Florida Advanced Surgical Team, FIU-FAST. And Ruben was right. If anyone gets sick here, we're ready. We are really ready. Our faculty, the team members from FIU-FAST are ready to help in any way possible. It's a gorgeous South Florida day, but in a month is the official start of hurricane season, and this is just a reminder that it's not if, it's when, folks, and we know that in South Florida. And we will have a hurricane. We hope we don't have a hurricane this year or any other natural disaster, but if we do, we want to be prepared. So on behalf of our president, Mark Rosenberg, and our board of trustees, welcome. This is an important event for us where we can be part of a solution for South Florida with our community partners. What we know is there is a critical need for disaster medical response in the state of Florida, and FIU-FAST has been filling this need with a one-of-a-kind team to provide ICU and critical care in the wake of a disaster. I'd like now to share with you a video which gives you a small glimpse of what this team is all about.
The mission of the FIU-FAST team is to do critical care transport or critical care stabilization in the field after some sort of disaster. Our ability to take 10 patients at a time, 10 critical patients at a time, makes us very unique to the state of Florida and unique to the country.
Well, we're really delighted to have FIU involved with the FAST team because we've got to a point in the development of the FAST team where we need some additional help and support. And so it's a real natural partnership. We need people with a willing heart that can drop everything. Not just your prestigious capabilities and your knowledge, that's important to us, but also the willingness to leave at a moment's notice, leave their families, leave their employer for a short period of time and really make a difference.
I joined the FAST team because it's what I felt in my heart I was meant to do. I think if all of us could do this full time, we would.
I've been a nurse for almost 30 years. It's nice to have that feeling of helping people.
We do what we do because we believe that what we do truly makes a difference.
You're caring for patients that really need it at that moment. They are so appreciative of it. It gets back to the root of why I became a doctor to begin with.
Just a few other introductions. Real strong partners for South Florida and for emergency response, Javier Hernandez-Lichtel. Javier, welcome. And from Nicholas Children's Hospital, Narendra Kinney. So this is really a community effort. It really is. And I like to thank all of our sponsors for helping us, which has really created dollars that will support this unit in perpetuity through endowment. And so this is really a community asset. It is an asset of the state of Florida, and we are very, very grateful. So from day one, the Herbert Wertheim College of Medicine has been here to help the community and to train the next generation of medical students and doctors. FIU-FAST will help us accomplish both. We will train our students so that they can become doctors, and they will become part of our voluntary team. And we will encourage our expert faculty, our more than 1,000 community faculty, to join FIU-FAST as volunteers, enhancing the capabilities of the team to respond to any disaster in our community. So on behalf of President Rosenberg and our Board of Trustees, Vice Presidents, and Deans, we really appreciate your being here today for this demonstration. Thank you.
Let me introduce the commander of this team. Again, you may think this is an FIU event, and you may think this is just an FIU team, but this team is a partnership with a team that was already in place before we showed up, a team that's been very successful with strong leadership, a significant amount of experience, and also a significant amount of medical cash that we already are starting with. All FIU is partnering and taking the current FAST team to the next level by strengthening with more capacity of physicians, more medical equipment, and also the name and the respect that FIU carries in this community and across the country. We couldn't do this without our commander, Steve Williams. Steve.
Thank you, Ruben, for a great welcome, and thank you, Dean, for everything you've done to support the team. I want to give you a bit of background. You saw what we can do out in the field. The South Florida area, like the Florida area, has a huge vulnerability. We have 20 million people in the state of Florida, and every year that population is increased by up to 90 million tourists. So the state of Florida, several years ago, as a result of the Hurricane Katrina incident, decided to set up what's called the State Medical Response System. As you probably remember, during Hurricane Katrina, over 60 patients died in hospitals in the New Orleans metropolitan area because they were not evacuated prior to the landfall of the hurricane. And that really is a horrible indictment of our emergency planning, that we allowed so many patients to die in hospitals because they weren't moved. The state of Florida took the initiative to set up the State Medical Response System, which consists of 6 state medical response teams and the Florida Advanced Surgical and Transport team. Our mission is to come into an area or a hospital perhaps for a pre-landfall hurricane evacuation, or to come into an area where there's been a disaster, an earthquake. Today's scenario that we're going to act out is that we've been deployed as part of the state response to an earthquake incident happening on the New Madrid Fault up in the Tennessee Valley. Our job is to come in quickly. This tent that you see behind us is a 10-bed mobile intensive care unit, and we set that up in under 60 minutes when we deploy a full 24-person team. And the team is built on experience. As Ruben and the Dean mentioned, we've been responding to many disasters over the year. Our team members over the last 20 years have responded to pretty much every disaster that's happened within the United States, starting with Hurricane Andrew. And more recently, we were down in Haiti as part of the earthquake response. The experience that this team brings is really unbelievable, and we're very fortunate to have attracted some of the leading lights in disaster and emergency response. When we send out a 24-person team, the average cumulative years of experience of that team is about 400 years. Pete Allen is our deputy commander. Pete's a paramedic firefighter from Jupiter. He's been working as a paramedic for over 30 years and has been involved with National Disaster Medical System for 25 of those years, and he's been with the FAST team since the beginning. We have Dr. Joe Scott, who is currently serving as the Chair of Emergency Medicine at West Kendall Baptist Medical Center. Dr. Scott has been an emergency physician for over 22 years and has been involved in most of the deployments with the National Disaster Medical System since then. We have Dr. David Farsi, who's currently Chair of Emergency Medicine at Mount Sinai Medical Center and Director of the Surgical Critical Care Program. Dr. Farsi's had a long career of writing and research in emergency medicine and actually spent many years up in Baltimore. We also have Dr. Mauricio Lin, who's a professor of surgery at Jackson Memorial Ryder Trauma Center. Dr. Lin's got over 30 years of experience working in trauma and emergency response and spent time as a lieutenant colonel or a lieutenant colonel in the Israeli Defense Force, where he actually pioneered a lot of the protocols currently used for mass disaster response and recently co-authored a textbook on disaster response. We have a number of medical professionals, but all of us professionals that do this in the field wouldn't be able to do it without logistics support. We're very fortunate to have probably the leading logistician in the National Disaster Medical System, Artie Abreu, who works for Miami-Dade Fire Department, and they very kindly allow him time to do the work that he does. Artie has managed to take this team to the highest level in terms of approval to get our equipment and personnel onto U.S. aircraft. So the U.S. Air Force actually allows Artie to come on, load plan, and certify the load, and that allows us to move much more quickly when we have to move to respond to a disaster. So we have a wide range of people. We have some of the most experienced disaster responders in the country, and with the help of FIU, we're actually going to be able to take the team to the next level. The resources, the ability, the personnel that we've been able to access by this new partnership is outstanding. We've been fortunate enough to include in our team now Dr. Eileen Mardy, who's got a long career in infectious diseases, has been in the Navy and responded to many incidents. We also have Dr. Rob Levine, who's the founding chair of emergency medicine at FIU, and these are the first FIU team members who've joined our team. And with the team, as we're beginning to structure it, we will be able to provide the very best levels of critical and emergency response when called to do so. So the exercise today is predicated on the assumption that there's been a large earthquake in the New Madrid fault area. Hospitals have been impacted both because they've been damaged and they've got patients that were in the hospital that were further injured by the earthquake, and then there's also patients who are injured out in the surrounding communities. And the plan is that teams like us come in, help set up at, say, an airport, and then as the patients are brought to us, we stabilize them, prepare them for critical care transport, either on private air ambulances or on U.S. aircraft, such as Air Force Critical Care Transport Team aircraft. So our job is to take patients who are critically injured, stabilize them, and then prepare them either for onward ground or air transport. And so today we have our partners with Miami-Dade Fire Rescue, who are going to be bringing in several helicopters. And the plan will be that you'll sit here. We're going to go into the tent, and we'll take some video in there so that you see what's happening. And then we'll be moving the patients from the tent out to the helicopters as they land. Ruben, do we have an ETA on the helicopter? Okay, quickly take any questions. Anybody got any questions? Sure. Great question. The question was, how many patients do we think we can treat? The mission of the FAST team in whatever environment we're deployed is to be able to be self-sustaining for 72 hours until additional supplies and resources come in. We have the ability at any one time to manage 10 critical patients with ventilations, invasive pressure monitoring, full pharmaceutical support. With the partnership that we've just signed with FIU, we're going to treble that capacity and bring in additional capability to allow us to manage up to 30 patients at any one time. Over a 72-hour period, as those patients are taken out, we'll receive new patients. The estimate is somewhere between 30 and 40 a day with our current setup, but when we go to the additional equipment and capability that FIU will bring, that will at least treble that throughput. Any other questions? 1 minute. Without any resupply, 72 hours. We have enough pharmaceuticals and equipment and personnel to man it for 72 hours. As part of the state medical response system, when we are activated, the state medical response system and the Department of Health for Florida activate a sort of cash support. So they bring in new pharmaceuticals and they bring in new, for instance, oxygens. For critical care, if you've got 10 ventilated patients, oxygen's a critical need. One of the reasons we're looking at Forts USA is they have an amazing oxygen generation capacity. So that's one of the partnerships we're looking at, is how can we improve our initial 72-hour sustainability by partnering with FIU and some of the commercial organizations that have that capability. So we have a willing patient volunteer who's one of the staff here at FIU. He's currently hooked up to a ventilator, and the plan is to, when air rescue lands, he'll be taken out and packaged and put in the aircraft. One of the reasons we designed this ICU in a tent is that when you're going into a disaster area in a hurry, you need to be flexible in how you get there. Sometimes the Air Force doesn't have a C-17, which is really the Cadillac, and we might have to do it on a C-130. So this entire mobile hospital, this entire 10-bed mobile ICU can be put onto pallets and then put in a C-130 or a C-17. Here you can see Miami-Dade Air Rescue has two 412 helicopters. These two helicopters are the leading helicopter response in Miami-Dade County for trauma and inter-hospital transfer. One of the busiest services in the United States, funded entirely by the Miami-Dade taxpayer, so it's a great resource. You can see that the elements of Miami-Dade Fire Department are very well coordinated in terms of setting up a landing zone outside an airport. Most of Miami-Dade's trauma responses don't happen on approved airports, they happen by roadsides, and that's when a lot of accidents happen. So Miami-Dade has an amazing safety record for doing this. And you can see that they have a suppression unit over in the back just in case there's any problems. Out of the helicopter comes the medic. The medic will go into the tent, and then the medic will take report from the patients, and then one of our team and the Miami-Dade Fire Rescue medic will take the patient out to the helicopter and actually fly off to the airport to rendezvous with an aircraft. Most of the staff that work for the FAST team are actually flight nurses, flight medics in their main jobs, so they have a lot of experience in helping loading aircraft, which is one of our primary functions. You can see that this patient has all the critical care equipment secured at the end of the stretcher. That amazing device was designed by a guy in the US Air Force who was sick and tired of equipment continually falling off stretchers as they were loading them into aircraft. So it enables the patient to be safely moved into the aircraft without any of the equipment falling off. One of the main missions of FAST team is to come in a pre-hurricane landfall incident. If you take the hospital down in Key West, for example, Lower Florida Keys, they only have 12 ICU beds. Anytime you have an ICU patient who you have to move, there's a statistical risk just in moving the patient. Some of the patients that were moved out of the hospitals in New Orleans actually died during transport. So the hospitals that are remote, for instance, Key West Hospital, will leave moving patients out of the ICU to the last possible moment in case the storm's not coming for them. So that increases the need for a team to come in and provide emergent, very quick response critical care, because they may only have 12 or 14 hours before the storm comes in to move the patient. So you can see that while one patient has been moved out, this other patient has been stabilized. And then the next aircraft that lands, we're going to be loading two patients. One patient's coming from our facility, and the other patient is coming from the facility over here on the left, which is run by Forts. And it's a completely modularized intensive care unit that comes in on the back of a trailer. What you just saw executed there was what we call a hot load. Obviously, there are times when time is critical and you don't have time to shut down the helicopter. So a hot load is where the rotors are still turning and the team bring the patient in and load while the rotors are turning. And obviously that's a more risky process, but it saves time, and as long as you're properly trained, it works well. The Bell 412 helicopter has the ability to take up to 2 patients and 2 medical crew. So what we're going to demonstrate now is how you load 2 patients into one helicopter. As you look at the aircraft, you'll see one of the crew members is stationed towards the back of the aircraft. That's to protect anybody from going too near the tail rotor. Don't know if anybody you saw this week or early last week, a football player got out of a helicopter and went round the back and nearly lost his head in the rotor blades and the tail rotor. You'll also see on this patient movement there's some medics and nurses from Life Flight. Miami Children's Life Flight is another partner down here in South Florida. They operate a Sikorsky S-76 helicopter that does a number of pediatric and neonatal transports every year. And the paramedics and nurses at Miami Children's have been a great support to the local community, not just in South Florida, but actually flying outside South Florida to bring patients in, children and neonates, into the South Florida area to Miami Children's Hospital. They're one of the few helicopter programs in the country that can actually do ECMO in flight. And that's a very sophisticated heart-lung machine that they put neonates onto that can actually save lives by transferring children, babies, premature babies, from small outlying hospitals that can't manage them to a center of excellence like Miami Children's. And we're very grateful for Life Flight being here today. One of the reasons that we focus on the use of rotor wing aircraft is that in many hurricane disasters that we've deployed to, often the road conditions don't allow for ground transport of patients. We deployed to Hurricane Charlie in Punta Gorda, and when we first got there about 12 hours after landfall of the hurricane, the roads in the surrounding area were impassable, and all the hospitals were damaged or out of action. So for 2 weeks we provided care to the citizens of Punta Gorda in that area of West Florida until the hospitals can be brought up. But in that time we transferred over 15 patients by helicopter because that was the only way they could be moved. Okay, so that concludes our exercise demonstration today. This wasn't supposed to suggest that FIU would become a triage center in a disaster, merely that by the good graces of Dean Rock and the FIU team, they allowed us to put this on here. It's a great partnership with us and FIU and the other community partners that are going to be supporting this endeavor over the next few years, and I know that we're going to help impact disasters, reduce suffering, and save lives by the commitment that FIU have given to this team. So that the exercise is over. I encourage you to stay hydrated. Anybody that's interested in walking through the mobile ICU, or indeed the ICU here that's been set up by Forts USA, you're more than welcome to come forward, go into the tents and the ICU, meet and talk to the staff, and have any of your questions answered. And I want to thank you all for coming and participating. Thank you.